I have been involved in volunteering since I moved to Houston 18 years ago, and have been very involved in really 3 different areas. One is education, a second is healthcare, and a third is children's charities and so forth. I have been very involved with my alma mater, with Stanford University, and have served on the board of the Stanford Club of Houston and served as president for about 10 years, and involved with the fundraising efforts as well as send-off parties for entering freshmen, phone calls to parents, just making sure that for those folks in Houston who are Stanford alumni or entering students from this area have a sense of involvement and engagement by Stanford University locally. With the children's charities, I began volunteering with Child Advocates of Fort Bend 15 years ago. These are all children who have been either physically abused, sexually abused, or neglected. And so I really felt that I wanted to reach out and see if I could make a difference in these children's lives. And so I've been very involved with Child Advocates and volunteering. I've been on the board and actually now on staff as the executive director. And my involvement in healthcare has been primarily with the Fort Bend County area and working with Oak Bend Medical Center on their strategic planning and branding work in expanding their services to serve different populations within the growing Fort Bend County area. But most recently, what's been very exciting and is related to the center, is that I've been on the board of the Greater Houston Health Connect for the past couple of years, which is a terrific concept which is now, we're very excited because now the concept has come to fruition, and we, 2 years into it, are now launching Greater Houston Health Connect, which is a network that allows data, patient data, to be shared by all the different healthcare providers, hospitals, emergency departments, pharmacies, physicians' offices, and so forth, with the intent of improving patient care, healthcare, reducing cost, eliminating redundancies, and just really allowing everyone access to better healthcare in the Houston community. I'm inspired to reach out to the community and give back because I was raised to do that. My parents were very strong activists in the community. My mother worked at the hospital. She worked with seniors. She was a teacher. There was really never an opportunity for her to, she always reached out. She always helped anyone who was in need, and continues to this day to do that. My father is the same way. My father was very active with the Boy Scouts. He was active in the church. He would find families that needed help and deliver supplies, food, clothing, whatever they were in need of. So it was just ingrained in my childhood. We are very committed to advancing education, advancing healthcare, making sure that our social service agencies are supporting the populations in our community that unfortunately have been vulnerable populations. So I think that that's been something that we have, those of us in Fort Bend County who are involved in this work, feel an obligation to do. It helped me learn about thinking about the issues that face our community in a very long-term focus. The scenario work we did, the strategic thinking that we did, really took us out of the day-to-day and talked about the possibilities, looking at issues from a collaborative standpoint, from a multidisciplinary standpoint, kind of the what-ifs. So it was a great way of uniting great thinkers, innovation, collaboration, and I think a sense of community and working together with a lot of different folks from a lot of different backgrounds. fortunate enough to meet a young lady 3 years ago who had been suffered a tremendous amount of abuse throughout her life. She was 15 years old and had been a victim of sexual abuse and physical abuse. And when I met her, she was acting out. She was unable to form relationships. She didn't have a lot of friends. She was kind of a loner. And we, the staff at Child Advocates and myself, reached out to her. She became part of our client team, if you will. And over the course of the 3 years, we have taken her on college trips. We have taken her on, we have developed life skills training, and we have helped her understand how to interview for a job, how to put a resume together, how to rent an apartment, how to build her skills so that she can be independent when she turns 18 and is an adult. And so it's been a tremendous journey that this young woman has gone on. And fortunately, I've been able to be there and support her throughout that process. Most recently, she asked me to write a reference for her for college. She decided that she wanted to go to college, something that would never have been in her wildest dreams. And most recently, she was accepted to UT, McCone School of Business, and she is, in fact, starting this week.